people make their own decisions. Here we invite experts to discuss and explore diverse opinions, perspectives, various issues, problems, and their solutions on various fields, including art and culture, healthcare, environment, education, and many more. We've covered over 150 talks as of now, more than 150 talks. Each webinar is an interactive session with a deeper understanding of the topic at hand. If you miss any part of the session or would like to go through the previous sessions, please visit our website vishwa.org or Vishwa Talks YouTube channel for a full library of past Vishwa Talks on various interesting topics. It is a real privilege to welcome you all to today's session and to introduce our speaker, Ms. Sadia Horzuk. Sadia is a psychologist with more than a decade of experience dedicated to dementia care. In her current role as program manager and psychologist at the ARDSI Hyderabad Deccan chapter, she works closely with families and individuals, providing support, care, and guidance in their dementia journey. She has worked in diverse settings, hospitals, memory clinics, and daycare centers, bringing a strong belief in person-centered care and the power of meaningful activities for people living with dementia. Alongside her practice, Ma'am has also contributed to important research, including the International Stride Project with the London School of Economics, NIMHANS, and ARDSI. Beyond her professional achievements, what truly stands out is her passion for raising dementia awareness across India and giving a voice to those impacted by it. Her contribution to the book Dementia Care, with a chapter on rehabilitation in dementia care, is just one example of how she combines knowledge, compassion, and advocacy to make a difference. We are very fortunate to have her with us today. Please join me in warmly welcoming Ms. Sadia Hazrat. Just a moment. As we dive into today's interesting discussion, I would like to inform the audience that our speaker will be taking questions from you after our main talk, so please leave your questions in the chat box, or please use the raise hand tool in the React section of Zoom. We will allow you to ask your questions in person. I request everyone to please limit the interaction part to questions, and you can share your experiences, opinions, and perspectives in the chat box. Without further ado, let's welcome Ms. Sadia Horzuk as she shares her inspiring journey and valuable insights into dementia and Alzheimer's care together for awareness, support, and hope. Good
Thank
morning.
you so much, Trishant. It's lovely to be back with Vishwa Talks, and
Welcome.
thank you so much for this opportunity. And I really would like to echo with the founder of the organization, Ms. Shrivani, that the need of awareness is so much in the general public about various things. And I really appreciate and hats off to Vishwa Talks on the work that they are doing. So good morning, participants. Lovely to see so many people on a Saturday morning over here to understand what is dementia and have a better understanding what to do or how the journey of dementia goes. So I will quickly try to share my screen. Um, um, we put it on the slideshow. Does this work? Is this okay? Tushant, just give me a minute. I think this. Yeah, perfect. I think we are good here. Yeah, thank you so much. So, good morning. And as you all know, that I'm going to talk about dementia and Alzheimer's. September is the Global World Alzheimer's Month, where globally all the dementia organizations and Alzheimer's NGOs try to reach out to general public as much as possible so that people are aware that what is dementia, it is a disease, and what to do about it. So I'm quickly going to take you through the understanding of dementia. So when we say dementia, I think people are more, used to the word Alzheimer's. they are one of the same. Dementia is mainly a cluster of symptoms, whereas Alzheimer's is a disease that happens in dementia. So, what happens in dementia? People generally forget, and that's how we all know that okay, dementia is the disease of forgetting. But it is not only forgetfulness, it is the complete disease of the brain where the brain shrinks or there are deformities in the brain. So, dementia is not like a psychological problem, it is a psychopathological problem where the brain has clearly pathology in as people age or because of different diseases, or it can be multiple issues why there is some sort of a change in the brain which causes dementia. It covers a range of physical diseases. It is very progressive in nature. So that means that dementia will keep on increasing as as time goes by. Eventually it is terminal. Unfortunately, there is no cure for dementia. There is no medicine that will cure the disease, but there are a lot of medicines that will take care of symptomatic things that happen in dementia. Why are we talking so much about dementia, and why you will see now and then you will hear about it? The reason is that people are not much aware that it is a disease, how to take care of it, yet there is a huge number of people living with dementia in India. In Hyderabad, there was a survey which was done by NIMS Hospital in 2013, and that time they quoted that there are about 40,000 plus people. By now, this number has doubled up. So I can easily say that there are more than about 1 lakh people living with dementia in Hyderabad alone. Now the thing is that where are they? Why are they not coming to hospitals? So let's try to understand. Now, what happens in dementia? As I said, that there are brain changes, there are nerve cells that are damaged, and the connections are lost. Memory loss is one common thing that we hear about dementia. Then, other than that, there is a thinking problem, there is cognitive issues, judgment making problems. Then comes the behavioral changes, where there are a lot of psychological issues, where there are which are called BPSD, behavior and psychological symptoms in dementia. Dementia also impacts the daily life. So the person is not able to do their own basic activities of daily living, like eating, taking care of themselves, going to shower, or somebody has to constantly keep them telling that what they are supposed to do. When they get up in the morning, they're supposed to have breakfast. So they are completely dependent on somebody. And as I said, progressive decline is there. That means it is a neurodegenerative disease where the symptoms worsen over time and it leads to the dependency on other people. Eventually, it is terminal. So when we talk about our brain, that dementia affects the brain, you see that this is a healthy brain, and brain has multiple functions. Everything that we do is a command of the brain. So the thinking, planning, organization, memories, short-term memories, long-term memory, autobiographical memories, everything related to our life, our background, our culture, everything is stored over here. Everything that we do, like just sitting over here, talking to people, understanding which button to click, what, everything the brain commands. And when the brain gets impacted in dementia, all these things are impaired. And that's how we see that there's a major change in people who get dementia. So at this point, I'm seeing so many doctors, so many teachers, people who used to work in farming, they have got dementia. Like they were some personalities, existing personalities, and suddenly in the last 5 6 years they have come to a point where they don't even understand that where they are, they don't know what date it is, there is no orientation. So that is a major change that happens in dementia. Basically what happens is like our brain is not able to give the correct message, the direction of message that the way it travels, our signaling system, it gets impacted. So when we give say an instruction to the person with dementia, they don't understand what I am speaking, what I'm trying to instruct, or or how they are supposed to behave or react to that. So types of dementia. As I said, Alzheimer's is a very common thing that we all must have heard at some point. After that comes vascular dementia, which is caused mainly due to stroke, post-stroke, or there are other types of dementia like Lewy body, frontotemporal dementias. So dementia is basically a umbrella term describe to a range of symptoms associated with cognitive impairment. And under that symptom or under that umbrella that you can see, then comes Alzheimer's, vascular, Lewy body, or frontotemporal. Dementia is very complex disorder. As I said, it is related to brain, and brain itself is very complex. But as somebody gets dementia, it just makes things so complicated because the person understanding is not there. There is a dependency. And every time when we talk about dementia, it is not only the one person who is impacted, it is the entire family unit which is impacted. So let's see, every time, I get a lot of people who say that, I'm forgetting, I think I have got dementia. Or people would say that I got so confused, I think I have developed dementia. It is not like that. Dementia has to be clinically diagnosed. First, we need to understand that there are multiple things that can also have a pseudo dementia kind of a state. So there are a lot of states, there are a lot of things that happen that can lead a person to behave like a dementia symptom, but it is not. So dementia can be reversible cause and irreversible cause. Reversible causes, as they are listed over here, like say if somebody is taking a psychiatric medicine, somebody is like having depression, or there's some sort of a very acute viral infection or other infection or certain medication, brain tumors, or metabolic disorders, vitamin deficiencies, these can have some impact on our memory or judgment, and where it can show like dementia like behavior, where there is a memory loss, confusion, disorientation. But when these things are treated, they will get cured. So this is reversible causes. This is something like we need to understand that it is not that every time I forget I've got dementia. Every time there are multiple reasons why somebody can have a memory loss, or it can be a fall, it can be a head trauma injury, something like that. But in dementia, which is irreversible cause, it is clear that the brain will have some sort of a pathology. There can be like a shrinkage, or there can be clots or something. So that is something that can't be reversed. So that is Alzheimer's, FTD, or vascular dementia, post-stroke dementia. Those are irreversible, that we can't reverse. Whereas the reversible cause that are listed over here may be multiple reasons. And that's the reason why we need to go to a doctor to understand that what exactly is happening. So certain causes, yeah, this is exactly what I was talking about. So the Alzheimer's, vascular dementia, Lewy body, from frontotemporal, dementia caused because of Parkinson disease or Huntington disease. These are irreversible, whereas the other ones are reversible. So one thing about our community, and I absolutely understand that, a lot of time we neglect our health. Our healthcare trajectory is very different. We'll be like, it's just a little bit of symptom. I think I will overcome it. And like that, weeks pass, months pass, and we just delay going to the doctor. But at this point, I'll take the liberty to like remind you that if you feel something is amiss with your own body, with your own self, you need to reach out to at least to the family physician and discuss. Not necessary that you end up to a specialist or a very extreme this thing. You at least need to reach out to the basic doctor to understand that, okay, is there something that I need to be concerned about, or is there something. So when we talk about, see, these reversible things, it can be because of the hypothyroid or diabetes or abuse of alcohol. So they will give us the right channel to understand that where we should be going, rather than we taking a decision that, okay, I really need to go and see an expert at this point. So this is something that we all need to understand, that there are certain reversible causes and irreversible causes. Now, in when we say that, as I said, like a lot of people will say that, oh, I have just got dementia, I'm forgetting so much, I'm so confused. But there is a significant difference between the normal forgetfulness, like you and me will have, and a forgetfulness of AD. AD means Alzheimer disease or dementia. So in a normal forgetfulness, say, I went somewhere. I went to Bombay and I completely forgot about it, like which flight did I took, which day it was. But then when I try to retrace my steps or retrace the whole thing, I am able to recall. If nothing, I will go to probably my phone app and see that when did I go, which ticket did I book. So I know how to, a normal brain knows how to retrace, to recall. Whereas in a dementia scenario, they might completely forget the experience. They might be like, they might have spent like 5 years in Bombay or something, and they're like, no, I've never been to Bombay. Or they might, end up saying something that they have never been to. They might just say, just to cover up the situation. So, one thing is that when we talk about dementia, like, yes, the brain is impacted. There's a lot of the domains of the brain, right? The understanding, judgment, orientation, everything is impacted. But at the same time, the self, the individual, the insight is very strong in dementia person, where they do have an understanding that I am forgetting. They, at to some extent, like maybe in the early stages to the moderate stage, they do understand that, oh, there is something I answered wrong. So they will try to cover up. Whereas in our this thing, we know that, oh, I'm lying. I don't need to, if I can't recall something, I might just not cover up like that. So in normal forgetfulness, sometimes, say I'm so excited, you probably bought a new phone. So you will keep on telling your friends that, hey, I got a new phone, I got a new car. So we repeat our stories in excitement, or to distant friends or to families. We'll be like, hey, I went there, I went to Europe and something. So that is our excitement. There is a reason why we are repeating it so much. Whereas in dementia, there is a uh, sorry. I'm sorry, I heard somebody talking. So not sure it was just a random this thing. Repeat in dementia, there will be repeats of question and stories, or something like, they might just keep on asking, what is the time? What time is it? Where am I? Even if you say that, yes, this is like, right now it's 11 o'clock, it just doesn't register to them. And that is the short term memory that happens. And that's the difference between a normal person and a dementia person, where they will keep on asking the question even if you have given the right answer to them. Or they will keep on asking, what's your name? Where did you come from? What's your name? So even if you like answer it, you after 5 minutes again they are going to ask the same question. And the thing is, as I said, that they do have the insight, they do understand how I am behaving or you are behaving. So, when we get irritated with those repetitive questions, there's a high chance that they will also get aggressive about it. So, then in normal forgetfulness, like we know how to read, write, the language part. If there is something written, or we know that, what are the proverbs or something like that. Whereas in dementia, as the brain gets impacted, they forget the language. So, for instance, like, generally in our community, we all are multilingual people. Like, we know English, Hindi, Telugu, so many language. But there will be a primary language, my mother tongue, right? So what happens in dementia? First, they will start forgetting the secondary language that the brain has picked up when, like, when maybe in school or in work areas. But the secondary language they will start forgetting first. So when, even though they've been talking, say the secondary language, it could be English or Hindi for all throughout their life, suddenly they're not able to understand that. So it is not exactly, and one thing you need to understand that each and every dementia person, individual, is very different. So we can't compare that, oh, this is the same thing, or you can't be comparing that, oh, this is what Sadia said, so this is how it has to be. No, each person, each individual is so different. Each type of dementia is so different that it will keep on varying. So these are like some common things to understand, not like, just to copy paste and see that, oh, this is what happened. So just to try to make you understand. Right. Then dementia risk factors. Now, this is something that I really wanted to emphasize in this talk, are risk factors and preventive measures. So You go to any doctor, I think they're going to say that, okay, you need to have a healthy lifestyle, good sleep, a better lifestyle which has like good health, eating habits. That's exactly the same thing every disease would probably ask for. So even in dementia, the risk factors, the causes that can impact how somebody will have dementia are listed over here. So which are like limited education. When we say limited education, it doesn't mean that illiterate people will have more of dementia. It is not like that. Limited education, when it is said over here, means that those people use less of the cognitive domains. They do not like if you have to see the examples of it, a literate person will probably read newspaper, they will have like something, maybe working in office, so that adds up to the cognitive well-being in comparison to the person who is illiterate. But in an illiterate, if you have to take an example, maybe that illiterate is doing other cognitive activities. It could be like farming, gardening, or some other skills. So that balances out. But limited education is one of the risk factors. Hearing loss, a loss of smell, that is again a risk factor in for somebody to get dementia. Hypertension, high cholesterol. I think this is something we all need to work on. Obesity, extra weight, use of alcohol, smoking, head injuries, especially people who are, using bikes or use helmets. It is something like a very small thing. Every time you will hear everybody saying that use helmets. Trust me, like it is one of the cause. Like I have seen people who fell or had accidents in their 20s and 30s, and by after 20 years or 25 years, they have developed very random dementia. And it's very difficult for the science also to prove it that what happened. But with you thin line to the point that, oh, there was an accident and he was not wearing a helmet or she was not wearing a helmet. So it does impact, even a small impact to our brain, because brain is a very complex thing, very delicate thing. It's very difficult to say that what will happen after years, after say a fall or trauma. So it is not necessary every time it happens, but then yeah, when we know it, why not to be prevented? Then depression or psychiatric illnesses or social isolation, our lifestyle has become so much like that. We have a lot of friends on phone, right? We have on Facebook, on WhatsApp, but in person, we do not meet people. And that is the social integration, which is very much needed for a well being of any human. Then physical inactivity. I think earlier, if we see like our grandparents, even till our parents, they had so much walk. Today, when I come to office, I'm just getting dropped door to door by a car or a cab, and then there's hardly any physical activity for me unless I take out that physical activity time. I go for a walk or something else. So that is the inactivity that we have absorbed in our lifestyles. I'm sure a lot of people will agree over here that, compared to the older generation, and as Shivani ma'am was saying in the video when we started, right, that our grandparents had so much of better life or knowledge, then our parents had lesser than that, and we are definitely much lesser. So imagine that our generation, the next generation, what is happening to them? There is a very high level of inactivity, physical inactivity. So now they are glued to phones. There is actually a study which was published very recently, which said that this generation, the younger generation, is having high risk of dementia or cognitive impairment in late age because of the inactivity in their childhood. So we need to be very careful of how we are spending our time right now. So one thing, dementia doesn't happen like in a go. It is not like one particular day the brain will start showing any pathological impairment. Dementia actually starts like 15, 20 years before it starts showing any symptom. So say some person is in 60s and is showing dementia symptoms, there's a high possibility that the atrophy or whatever the change is happening in the brain actually started 10, 15, 20 years back. So if you have to think about it, like people who are in their 30s and 40s, what you're doing right now is going to reflect after 20 years. Okay. The same way, people who are in their 50s and 60s, what you're doing now or what you have done before is going to reflect, but you have not lost time. People in 50s and 60s and even in 70s still can, pick up better lifestyle and work on it, and that will definitely help as preventive measures. So these are certain warning signs to watch out that somebody is having some sort of a cognitive impairment. Memory loss, as it's a very common thing that we know that, okay, it starts, dementia will start with memory loss, but it will also start with difficulty performing familiar tasks. Like, say, there's a housewife who has been cooking throughout her life, and suddenly she's not able to make like a small rice or tea, not able to perform small tasks that they were familiar for years. Same way, like a man who used to go for grocery and suddenly he's not able to calculate the money, he's not able to get the grocery back. So sometimes we're like, we see these symptoms, but then we neglect it because we are not aware. And that's the reason why we try to promote so much that, okay, the more you know, the earlier you understand dementia or there are some warning signs in a particular person, there is a better treatment chance. When we say treatment, it is more like a care management. Now, the other warning signs are disorientation to time or place, not getting confused where I am, what time is it day, night, then impaired judgment, not able to make small decisions. Um, Crossing the road, or just like, is the water hot or the food has salt or not. So those small judgments are lost. Problem with abstract thinking, misplacing things, changing mood and behavior, and then change in personality, like somebody who has been very calm, very aloof, or very say a very calm personality, and suddenly getting very irritated, or suddenly trying to shout at people, very verbally abusive or something. So these are the signs that we need to be very careful of. Then there is loss of initiative, which means that a person just doesn't feel like doing anything. So they'll get up in the morning and they have no plan for the whole day. So they'll, unless somebody says, get up, brush yourself, have breakfast, so somebody has to keep on probing. So you have to start observing that are there some changes in the people around you who you observe or who you live with. And one more sign to be aware is like challenges understanding in visual and spatial information, which is more like, they are getting confused with colors or 2D or 3D effects. So these are certain signs to watch out for. If you observe these signs, what to do? You basically, first, as I said, that reach out to a doctor for a consultation. Go to a doctor, discuss that what is happening. Then, the doctor, if it's like physical, if it's like just a physician, maybe they will recommend you for other doctors. So if there are these warning signs that you have observed, so for dementia, or you can reach out to a memory clinic, or you can just reach out to a neurologist or a psychiatrist or a general physician, your family physician. They will do cognitive assessments, like to understand what is happening in the brain. They might ask for certain blood tests, scans, and then the diagnosis happens. So this is exactly how it should be. And we, after the diagnosis, it's a complete new journey that starts for the person with dementia and for the family itself. So, yeah. So there are different types of, when we say that there is no cure for dementia, then why are we talking so much about the treatment? Yes, there are certain medicines that will help to slow down the progression of it, or there are some symptomatic medicines for behavioral issues. So you have to be in the loop of your doctor. And dementia is something that you need to understand that it is like not impacting one person, it is impacting the entire family. At the same time, the care that you need is from a doctor and from, say, a dementia expert who's a psychologist, or other or a non-pharma intervention. So now on the screen, if you see, there is a medical treatment. So you have to go to your doctor for that. But there is non-medical treatments also. That is care management, because dementia is something that every now and then there are new types of symptoms, challenges, issues, and those can be handled with care, or which can be managed with understanding, not necessary with the medical treatment. So there are a lot of things like, say, as there is a repetition, they'll keep on asking same thing again and again. You can't go to the doctor and say that, there is a repetition, I'm getting irritated, they are getting irritated. There's no medicine for it. So there is care management. There are other ways. That's what we call it, non-pharma interventions, non-medical treatment for it. How to manage these challenging symptoms, what to do when there are these symptoms which doesn't have any medical solution. So there are other therapies like cognitive stimulation therapies, which is something brain exercise. Or there are other services like a daycare for dementia, where people can spend the whole day, get stimulated, be busy throughout the day. Or there are other places like residential care where they can stay for good. Then, in the last column that you see, that is for the caregiver. Now, the caregiver is a very important person in the whole thing, whole journey of dementia, where they are managing the person with dementia, they are managing everything. So, there is a lot of ask for the caregiver itself. We will keep on, we will counsel the caregiver more than we counsel the person with dementia. So the family needs a lot of counseling, training on dementia, and it's literally the new journey that starts from. So I just wanted to give you an example of a dementia journey. So there is this Mrs. Chirat, which is a very anonymous name. Then she had dementia. She lives with her daughter, and there is a granddaughter, and she needs help. So she's in a very severe state. So every day she needs help for dressing, eating, washing, going to the bathroom. She's having difficulty swallowing things. So, which is also in a very severe stage of dementia. It is part of it where they are not able to swallow well. So, when we say that the brain is getting impacted, so far I think what I have said is like more cognitive things. But as time passes, like as the disease progresses in the moderate to severe stages, the body also starts forgetting the functions. So it is like, there will be difficulty in swallowing, the muscles will slow down. So it takes them a lot of time to understand how to sit on a chair, or what is the purpose of a chair, right? Then, taking this example, this lady, like she had memory decline, there was a high dependency on caregivers. So that means the daughter and the granddaughter has to continuously care for her. They have to cut down their own activities like going to work, going to college, meeting friends for the sake of their loved one with dementia, so that they are around, and it needs a supervision. It is not the best of the example, but then the brain actually becomes like a 5 year old or less than that. So they need a constant supervision. They don't understand what are the risks, what are the hazards. They might just put on the gas and just forget about it and walk out. So it is very difficult, it is very challenging, and the family caregiver has to continuously support the person with dementia, right? Then there is the isolation and limited mobility. So even for the caregiver, there is a social isolation. They're not able to go to friends, to family functions. They're not able to bring the patient to the family functions. So there are so many things that gets impacted. So the caregiver will be emotionally, physically, financially impacted due to the dementia. These are certain different stages of dementia, where you can see in early stage memory problem, difficulty in thinking, language, communication, poor time orientation, mood changes. So in the very early stages, you will see that set of symptoms. But as it reaches to the middle stage, it becomes very difficult, where the family is having a lot of issues like continuously looking after the patient. It can be, and see, one thing is that Alzheimer, for example, Alzheimer's has a general lifespan of 10 to 12 years. So imagine like a person living with this kind of a disease for 12 years. Like one lady I knew, she lived for 16 years with Alzheimer's. Um, that is something, a very challenging thing to understand also, because the family continued, her spouse, who was also in the late 70s, continuously supported her, and the issues that he had, and then, financial burden because of, the medication, or because of the attenders that they had to get. So in the middle stage, which can be the longest stage also, it will have more of challenging issues, behavior issues, physical dependency. Then there is a need of attender, a paid care, and then not necessarily all the families will be able to afford that kind of a thing. So that's why we say that there is so much of emotional burden and financial burden. Late stage, it is a profound memory loss where they may not even recall that who is the immediate family. They may not recognize their own children, their grandchildren. There's an impaired communication. They are just not able to communicate. They want to eat something, they don't want to eat something, they're not able to say anything. Then there is an inability to recognize the surrounding, the house they are in. Is it, as I said, is it day, night? What time is it? Swallowing difficulties are there. Loss of recognition of familiar people. See, it is a very challenging thing when, say, a patient with dementia is not able to identify or recognize the caregiver, the daughter, the son, or the immediate family. It is a absolute, it shatters the person completely, that what am I doing it, why, I mean, who am I caring when they are not even able to recognize me, right? And then eventually, after the late stage, it is the end of life where people can be like completely bedridden. There are so many challenges that happens in dementia. So, why am I emphasizing it so much on dementia? Why has it become like a cause for dementia? In India, there are more than 8 million people living with dementia. And as I said, that it is not only that person, it is the 8.8 million families who are impacted with dementia, with all the issues that we've been discussing about emotional burden, financial burden, physical burden, and unfortunately, because there is not much awareness of dementia, only 10% of this number ever gets any diagnosis, any treatment, or care. So think about the families who are not getting any attention at all, or any diagnosis also. I have had so many families coming to me after their patient has died, and like, I think now it sounds that it was probably dementia. I wish we knew about it. We would have taken care better. What happens is, when there is not much knowledge, when there is no diagnosis, people just try to manage within their house with whatever knowledge they have, whatever resources they have. And it can be a mismanagement also. There can be abuse also. There can be so many negative aspects that happen. And the families who, like, the person will eventually die one day, but the person with dementia will die one day, right? But then the families who are the, say, the younger generation or the spouses, they live in guilt. I have so many people coming after, like, after that loved one has passed, like it's been 5 years, 10 years, because there's so much in guilt and so much in remorse that I wish I knew how better to manage. I wish I did not shout at them. I wish I could, there's so many things. And that's one reason we need to understand that dementia is not just for the elderly who is, cognitively impaired. It is the entire family unit which is impacted financially, emotionally, and it is not like it is ending with the patient. It is being carried on. The burden is carried on for years and years. So, one thing about our country and our community is that family predominantly provides long term care for people with dementia, which means that at home we are taking care. So, in the developed countries or in the Western world, they have dementia priority, like government priority, dementia as the health priority. So, they have a lot of schemes and a lot of policies for dementia. So a lot of places, say in US and UK, it is the government who supports the dementia care. So they will have residential care, they will have day cares, they will have like nurses coming at home. We don't have anything like that. So complete cost the burden comes on the family. It is so even if the family wants to put them in a daycare or in a residential care, it is the family who has to bear the cost, and we don't have that kind of services in our country. So in the box that you see on the left side, right, so for the 8.8 million people, we don't even have more than, I mean, I know I have written it less than 1,000 daycare or full-time care, but I know the actual number, and it is much much less than 500 also altogether. So we don't have services. We need, there is a huge need and demand, but then for some reason we still have to evolve in dementia care. So you can imagine 8.8 million people, when we say, it is more than like population of countries. There was a study that was there was a report actually that was done in 2010. So that means 15 years back, where they said that out of pocket expenditure for families for a dementia person was 45,000 that time. And of course, it's been 15 years, it has doubled up. So on an average, a family is spending around 75,000 to 1 lakh rupees per month for dementia care. We are talking about middle income families, upper middle income families. What about the families who can't afford? That's a completely different discussion. I think we have not even gone there to discuss. And it's a complete different challenge that they are facing. So dementia is complex because it is brain, but at the same time, socially also, it is very complex for families. At the same time, there is so much stigma attached to it, where people are like, because of poor awareness, people don't know that it is a disease. They will still talk about stigma, idioms, and in every language. So I had published a research article where we were able to list out the how each culture or a different part of India, how people pursue dementia. Like I remember in the North India, somebody gave an example that there was a dementia patient in a village, and because he was like soiling his clothes, there was so much incontinence, was not able to understand where to go for toilet and all. So he used to just soil his clothes and wander around, which is also a symptom of dementia. Kids used to throw stones at him. So imagine like an elderly in 70s having so much issues, and because there is so much stigma, the family is also like they don't want to get involved with it. They're like, okay, whatever. I have Unfortunately, I've had families asking me directly, just tell me that when is this person going to die? Because that's the only solution for them. So we have so many challenges, so many things that comes with dementia. So it is not just a disease; it is a social issue. There are so many things that comes with dementia. Now, how can we prevent dementia? Right. So there are yeah. So there was a study that happened, a Lancet publication, which said that 40% of these cases could be preventing by addressing these lifestyle modification. Actually, if you think about it, it is nothing much. It is just the lifestyle factors that we need to change in our daily routine that will help to prevent the dementia, our dementia, my dementia. So you can, exercise regularly, pick up physical activity that will keep you healthy, keep a track on. So you have to, basically increase your cognitive well-being, education. The more you read or the more you use your brain, physical activity, social contact, in-person contacts, adopt a healthy diet, eat well, sleep well. That is something very important. Sleep is directly associated with dementia. So get sufficient and quality sleep. Take time to de-stress yourself. That is something very important in today's life. I can just say for everyone, let it be any age group. We all are so stressed, which is causing hypertension, diabetes. So we need to control all these things. The more that we work on these aspects, it will help to prevent the dementia. Dementia can also be genetic, but that is something that we can't help. But if we try to adopt a lifestyle, a better lifestyle, it can help us all to reduce 40% of chances to prevent dementia. So I think this is absolutely doable, and we all need to work on it. Let it be like somebody in their 20s, 30s, 40s, 50s, 60s, whatever. I know so many people in their 60s and 70s, for the first time they have ran marathon or they have picked up cycling, long distance cycling. So it is all in our head that, oh, I'm 60 and I can't do anything. Oh, I'm 70 and I should not, this is not my age of doing anything. No, it is not like that. It is more in your head. It is more culturally that we think. If you want, you can just, pick up a physical activity, learn a new skill. Learning a new skill is basically that will help as a cognitive reserve. Now, so I want to talk about this cognitive reserve in dementia. It is nothing but a very simple concept. Cognitive reserve is basically brain's adaptive capacity to compensate for age related or pathology change. Basically, when we are physically active, when we have a cognitive well-being throughout our life, that will help for the old age prevention of cognitive decline, built through enriched neural networks, flexible cognitive strategies. So, when we talk about cognitive reserve, it's something very simple. Like the more activities that you have done in your younger life, in your 30s, 40s, 50s, even in 60s and 70s. So, it is like cognitive reserve is like the brain, the more you use your brain, it's going to be healthy. So, education, lifelong learning. When we say lifelong learning, pick up new skills. Say, learn a new language, learn a new skill like maybe swimming or maybe crochet, something that you have never done so far. Why? Because that is something that is the part of the brain that you have not used so far in your life. So when you're learning the new skills, it will help in a cognitive well-being. That will help your brain stay healthy. Mentally stimulating occupations. There are so many nowadays. We all are bound to a laptop, and it's a desk work. But there are a lot of occupations which are cognitively stimulating. Even a desk job is cognitively stimulating, but something like people with hand skills, or people who are like constructing things or building things, that also works as a cognitive stimulation. Social engagement and community participation, hobbies and art, music, storytelling. All these things helps as cognitive well-being and cognitive reserve, and eventually it will help in the prevention of dementia. All our spiritual practices, our prayers, bhajan, kavali, yoga, meditation, everything that you do will impact for the cognitive well-being of your brain. How the cognitive reserves in the protective role? It will delay the onset of clinical symptoms. It enhances the resilience against memory loss and functional decline. So, for example, somebody who has a very good cognitive well being or a cognitive reserve, who has used the brain very well, healthily throughout the life, when they develop dementia, also, it supports in a, if ever they develop dementia, I should say, that also helps in the dementia cognitive stimulation compared to the person who has absolutely no cognitive reserve, who never had any hobbies. So, the at the center where we do a lot of cognitive stimulation, brain exercises, it gets very difficult for us to work with people who never had any hobbies or who never knew any other skills other than whatever their work was. So it also works in protective role. In our culture, there are so many Indian specific opportunities. Intergenerational living. We have like, even though nowadays we all are nuclear families, but still our communication, the way we meet for maybe cultural things, or for the frequency of meeting, right? That also matters a lot. Our family dynamics. Then craft, gardening, storytelling, traditions. These are very low cost, sustainable things. See, these are the things what we are trying to promote. that you try to increase doing your hobbies and cultural things and religious things that will eventually help to prevent dementia, that will eventually help for your well-being. Okay. Yeah. So in dementia, there are these certain these are psychological symptoms that happen. I just want you to have a small brief understanding of it, that dementia can impact neuropsychologically and even with a lot of psychiatric issues also. So there are wandering, perseverance, aggression, lack of inhibition, hiding things, sundowning. So these are some common things that happen in dementia. And generally, why it happens is like it's an unmet need. To understand it, it is basically that when the person is not able to communicate, say they want to have a glass of water and they're not able to say it because the communication language has been impacted because of dementia, of course they are going to get irritated. Imagine like you want to say something and you're not able to say it. So how irritated you can be. There can be anxiety that I want something and nobody's understanding. So there's generally an unmet need what causes all these symptoms. There can be pain or discomfort, or it can be grievance, frightening, or a strange environment. So every time, parents are made to change the environment. If it is somebody with dementia, they will definitely have a lot of confusion and disorientation because they are used to that old house. That doesn't mean that we change, but there is a way that if they are put into a new environment, how to make the environment modification adaptable for dementia. Okay. Um, just a quick thing to understand that every time we say that in dementia there is a the functionality is declined, so they're not able to do their basic things and they need that self care. Somebody has to help them with it. So this is what happens in dementia, impact of the quality of life. The person is impacted. They have their own set of symptoms and issues. At the same time, the caregivers, the family is completely physically exhausted, emotionally stressed, financial strain, and the complete, as I said, that it takes them years and years to come out of that burden that they have gone through in the dementia journey. And it is not only the one caregiver in the family that is impacted, it is the entire family unit. So even if say the siblings are staying out, but the other sibling is taking care of the parent or somebody, it is the entire family unit, the dynamics changes. So it just makes things so difficult, and the entire quality of life of the entire family unit is impacted. So, yeah, talking about the caregiver, so, non-pharma interventions, right? Um, a treatment which doesn't require medicines. Yes, there are medicines required in dementia. At the same time, there are a lot of non-medical management that happens in dementia. So, interventions that does not involve medicines. There's the aim to support the cognition, the cognitive well-being that I've been talking about, right? Behavior, functionality, quality of life. There are a lot of therapies, environment changes, caregiver support, and meaningful activities that will help the person with dementia, right? It helps to slow down the progression. It helps in positive emotions, foster verbal communication. Even if they're not able to communicate, still they are able to communicate through the activities or the other therapies. Maintain abilities and independence. That's something very important for a person, and especially in dementia person, to improve their self-confidence, helps manage challenging behavior, improve quality of life. Eventually, when we talk about dementia, it is the quality of life that impacts or that is matters. So these are some therapies that we do under the non-pharma interventions. There are cognitive and emotional oriented interventions. Then there are brain exercises. There are multiple other therapies that we use for dementia person. And this is nothing like a rocket science. This is something we try to convey to the family caregiver also, that they adapt it. See, they are the best person who understand the dementia person. Their personality, what they will like, they will dislike, and based on that, then they can have. And these are something very simple. It's not that you have to sit the whole day and do it. Just 10 minutes every day, some of these therapies can be done and really have a good impact on the person with dementia. So when we talk about non-pharma therapies, you can see there is reminiscence therapy, going through the old memories, happy memories, pet therapy, music therapy, art therapy, speech therapy, physiotherapy. All of these will have positive impact on the person with dementia and something very easy to do at home. Cognitive stimulation, the brain exercises, as you can see, they help as equivalent to a medicine will help the person with dementia. So just a quick this thing that who are we? Like Alzheimer's and related disorders, Society of India, Hyderabad Deccan chapter. We've been working for the cause of dementia for the last 17 years in Hyderabad, and we've been providing multiple services. So we initially started because there was nothing for dementia care in Hyderabad, and in 2008, some caregivers their families and their parents were impacted with dementia. They came together, and that's how they started. And so the organization got built up on non-pharma interventions. So we work more on cognitive stimulation, a very holistic, collaborative approach, and that is what is needed for dementia. Mm. We also work a lot with caregivers for support groups and workshops, right? So these are some numbers that we have reached so far. And our services, so we run a memory clinic, we run a daycare center, which is called Alambana, where we do a lot of cognitive stimulation therapy. We also have caregiver support meetings every month, where we try to reach out to the caregivers so that we can, help them to understand better what is dementia, the symptoms, or any burnout that they are having. Then we try to do home visits for certain for people with dementia to help them in environment modification. We also run a helpline and a WhatsApp group where it is available for the caregivers, where they can, just ask any question that they would like to understand about dementia care, not mainly for the medicines, but non-pharma challenges that they face or the services that they want to understand that. So we initially started in COVID, and now we have about more than 200 families on this group across the India. This group has spread, and it is a live group. So there are a lot of experts from our end who are there. There are some doctors also available on this WhatsApp group to support the caregivers. Then other services that we provide is awareness drives, like how we are doing right now with Vishwa Talk. And then there are training and internships. There's research that we try to publish from our organization. We have recently started doing free clinics and community outreach where we go to these underprivileged areas and we try to conduct free memory clinic for poor people. And then we are in advocacy, and we've been doing a lot of free public memory screening camps where we try to just understand, like, for like how you do health camps. So the same way we are doing memory screening camps so that more and more people understand that what is happening and what is dementia. So thank you so much for listening through. And if you have any questions, I'm happy to take.
Thank you so much, man, for
Yeah,
the.
I'll stop the share.
Hello.
Yeah.
Yes.
Hello.
Thank you so much, ma'am, for the PPT. I'm just going to summarize what you've done. You've basically, in the start, given us a definition for dementia and Alzheimer's disease also. You've mentioned the characteristics, types. You've explained the diagnosis of it. You've explained the impact of it, how it affects 8.8 million people in India. Caregiving. Uh, You've mentioned about the prevention. You've emphasized on cognitive reserve through education, hobbies, social activities, and cultural practices to protect against dementia, and discussed non-pharmacological interventions, including cognitive stimulation therapies. Thank you so much for the wonderful PPT. I'd like to now invite our founder, Shivani ma'am, to take the session forward and initiate the poll and the Q&A. Good morning, ma'am.
Namaste. I would like to thank you, Miss Sadia. You've You've picked up a very important topic where a lot of families today are having old people, people with dementia, and it's a huge physical, financial burden, especially with families becoming nuclear, because of which there is abuse also, mismanagement, as you said. The degeneration of our joint families is putting a burden on one or two persons. The intentions may be good for the children, but the burden is huge. People to share is very limited. And to bring about awareness about this disease, what is it? What is reversible? What is not reversible? And how to deal with it? How to prevent it? How to provide for it? These are some things that we really appreciate that you've come forward and you're sharing your knowledge with people around. Yeah, thank you, Sadia. And thank you to all the audience to have come on such an important topic. I'm sure some of you all may have a glimpse of this disease and the havoc it can have on families. And thank you to the Vishwa Talks team for bringing such a pertinent topic and handling it so well. Thank you. With this, I'll quickly go into the upcoming talks and then we'll move on to the question and answer session. We have Trishant, can you talk about the upcoming talk? Yeah, I got it. Upcoming talks is Safe Soil, Protecting the Foundation of Life. Speaker is Sneha Koppula. She's a permaculture facilitator. 18th October 2025. It's at 11 o'clock. It's a fantastic topic. None of us are, some of us do have an idea about the importance of soil and why we need to protect it for posterity. It'll be great because Sneha, I have seen her personally. She's extremely passionate. She's been brought up in that environment, and her knowledge, though she's only talking about a limited topic about soil, her knowledge is vast in permaculture and farming and butterflies and mushrooms. You name it, she's extremely knowledgeable. It'll be fantastic to converse with her. Please share with your friends and family because sometimes our Facebooks and Instagrams don't allow promoting. So everything has to go with word of mouth. Please share it with your friends and family who are interested in this topic and who can in turn share it with others. Yes. And then there is another topic by Jyoti Reddy. The topic is on sustainable silks. She's the founder designer of Aristry International and Aristry Fabrics. This talk is on 25th October 2025, 11 a.m. to 12 p.m. India has been known for its textiles for thousands of years. And we are at a cusp where, we can lose this textile heritage that we have received, or we can protect it. With Jyoti Reddy, let's hope that some more awareness can be brought about in the field of textiles. Once again, please do share it with your friends and family. Yeah, with this, there's just one last thing I would like to talk about. It's about the material drive that Vishwa is doing right now. We do it generally Diwali time and Ugadi time. We personally pick it up from each of your homes in Hyderabad. So for those of you who are interested, please donate, declutter your homes. It's our culture that we declutter before all our festivals. So request you all to declutter your homes because those that you're not using, instead of letting it go into landfills, please let somebody else use that. Let it become fashionable to use used clothes, pre-loved toys, baby essentials. Let every item that we have bought into this world completes its life cycle. Let's not push them into landfills. Let's ensure that it gets recycled or given to someone who can use it. Last drive that we have done, we've picked up 72 trucks. There are around 500 plus slums in Hyderabad. We were able to donate to around 3-4 slums. Request that all of you all make this a huge success. A special thanks to Safe Express and Geetams, who have been giving their trucks every weekend to help do these collection drives and distribution drives. Yes, with this, thank you so much. Chmel, you can ask your question and unmute yourself and ask your question.
Yeah, you hear me?
Yes.
Okay, thank you very much. Very interesting presentation. I too very interested in the topic of dementia, and I want to ask you question: what impacts of poverty and social inequality on development disease of dementia?
Trishant, can you repeat?
Can I rephrase the question, ma'am?
Yeah, please. Yeah.
Ma'am, what sir asked, how does poverty and social inequality maybe affect dementia?
Okay. So it'll be very wrong on my side to say that poverty affects or illiteracy affects impacts dementia. It is mainly the inactivity or the poor cognitive well-being that will impact somebody, which can cause dementia. So it is not like poverty. See, in poverty, probably we can say that it is probably the nutrition or other health aspects, NCDs, non communicable diseases, hypertension, or other things which are not properly diagnosed. So that could be one reason. But it is not like poor people or illiterate people, they will have more of dementia. It is not like that. If they are healthy, if they are cognitively doing well, if they're using their brain to the best of the forms, I think that will definitely help anybody. So earlier it was called a Western world's disease, but it is not so. I think the times have proved it wrong. That even in India, let it be any background, class, or anything, people are susceptible towards dementia. So yeah, it is not like the poverty will impact, but there are other factors of poverty that can impact dementia. I hope that.
Yeah, thank you very much. And I have another short question. I want to ask you now uh, how occupation and cognitive activity can support prevention dementia.
So when we say that the occupation, how it's again that certain occupations are, say, somebody is a carpet maker or someone is using more of like skills, motor skills or cognitive skills in day-to-day life. It can be like a farmer. It can be like somebody, as I said, carpet, or it's something like hand weavers, right? So there are a lot of studies that are being, I think, currently conducted that the weavers of India will they have less of dementia. But it is not. See, that's what we say that dementia is very complex. It is not just one thing. Say there is a weaver who has been doing a very cognitive skill. So weaving is of course motor skill also. At the same time, it is a cognitive skill, choosing the colors, which patterns. So everything is like very intricate brain activity, which contributes to cognitive well-being or cognitive benefits. But there, if a person is having that kind of, if a viewer is having a bad diabetes or hypertension or stroke or head injury, that can lead to dementia. So there is not one particular reason that we can say that okay, a viewer will not get it. So occupation will definitely help in positive way, but it is not like it will completely remove the chances of somebody having a dementia, because dementia comes with so many different aspects also. It is because of so many different reasons. Yeah.
Thank you very much.
Yeah, you're welcome.
So, yes, Trishant.
I have one question. I read a article or something, a post about 2 years back saying that if you know more than four languages, your chances to get Alzheimer's reduces drastically. Is it true? Like,
Yes, because it's bilingualism, and because all the languages will have their own different. That's what I said. Like, when you pick up a new skill or a new thing, your brain is using that kind of the area which has not been used throughout the life. Say you have learned like four languages. So language comes with complete different set of their, what do you say, their grammars, their linguists and
pronunciations.
everything.
Yeah,
So
muscle
you are
memory is different.
using different part of your brain throughout every day. But then again, it's the same answer. Like you are bilingual. Maybe there are people who know 10 languages and they speak every day. But still, if their hypertension, their lifestyle is bad, then it is not balanced. So everything has to be balanced in a way. Yes, bilingualism will contribute to the benefit of like preventive measure, but at the same time, you have to consider the other aspects also, your sleep, your hypertension or diabetes or the other. So it is all combined in one, not just one little thing will be like, yes, it will give you a benefit of it. It will add like, okay, maybe to some extent it will be helpful. But if there are other things, like if there is a stroke or if there is a head injury or something, then it is not, it's not going to be preventable.
One more question. Thank you so much. One more question. How I wanted to ask if sound plays a role or loud sounds, mellow sounds, how do patients react to that? And does music help? Does it affect, like help jog
Yeah.
their memory or something?
Yeah. Okay, so two things here. Sounds, as in like when you say very loud, and we're talking about dementia patients here, people who are
Yeah.
diagnosed with dementia, right? Okay. So loud noise is generally considered as something irritable that can irritate them. So when we talk about environment modification, we always say that make sure that there are not unpleasant sounds. It can be a loud music or it can be continuous music. So when we talk about dementia patient, each individual is very different. Some people might love music, some people want that music going on throughout the day, but some people are not used to it. So it is a very holistic approach, what we call person centered approach for each individual. So loud noise can be something like a negative aspect, which is irritated. At the same time, if somebody likes music, someone who had a music as their hobby throughout their life, that will benefit them. That will help to slow down the progression where because they are enjoying that thing. Everything that happens positive in the dementia interventions will help for a better well-being or the quality of life of the person with dementia. So, music therapy, there are two things when we talk about dementia music, right? So, when we talk about music therapy, it's a complete different, it's a therapy that a therapist will do. They know how to use the instrument, they will use it for communication, or they will give the instruments to the patient so that they can express themselves. So that is more like a music therapy. Now we play a lot of old songs, or their favorite song, dementia people's favorite songs, if they like it. If somebody has a hobby of music, singing, listening to old songs. So I have, like, at my center I have people listening to music like NTR or Savitri, or Rafi music. So the that kind of music they love. That is more reminiscence therapy, recalling the past. So when we talk about music therapy, it can be divided into different
It can give
aspects.
nostalgia.
Yes, it's, yeah, nostalgia, something that, yes, they connect it very well. And if somebody enjoys it or somebody likes music, say someone, I have a live example. Like I remember this gentleman who used to love, Rafi music, and he used to have a lot of anxiety. So every time he was dropped to the center, so we run a daycare, right? So they used to come in the morning, and then every time he's dropped at the center, he'll be so restless. He'll just pace up and down and, just say that my wife just dropped me here. When is she going to be back? So these are very common things that we see in dementia, where there's a lot of anxiety, separation anxiety, and then there's a wandering. But we knew that he likes music also. He likes other things also. So, and he used to love sketching also. So every time he was getting into that distress mode, we used to quietly put on the music. Okay, we never used to say that, oh, see, we are putting on your music, come and sit. No, no instructions given. Only put on the music, just lay down some sketching material for him. He used to completely, gradually, it used to take 5 minutes, 10 minutes. He used to start humming to that music, start sketching, and forget about that. Okay, he had some sort of a depression, anxiety. So, like that, these therapies help. But then it is like some people like music and some people don't like. If they don't like, you can't force them to do it. When you force them to do something that they are not comfortable with, then it will backfire. Then there will be agitation. So you have to be, that's why we say person centered care. Each individual is different. They come with their own set of background, liking, disliking. At the same time, their own set of the dementia symptoms. So you have to combine both of it and then work on the therapy.
Thank you, Mom.
Yeah.
Jayashri, would you like to ask your question? Please unmute yourself.
Hello.
Hi.
Unmute yourself and ask, please. Yes. Unmute, yeah.
Hi, ma'am. Hi, ma'am. Good afternoon.
Good afternoon.
Yeah, good afternoon.
Okay, first of all, thank you so much, ma'am. It's such a wonderful, knowledgeable topic you chosen. That is, thank you so much for this sharing of thoughtful all the criteria for the dementia and the Alzheimer. Actually, ma'am, I'm from Orissa.
Yes.
Actually, I'm also working in the nursing field. I'm in this working in the School of Nursing. So actually, when the dementia is coming, ma'am, and when we are interact with the old age people, actually in this side, the family already they know that when the old age is coming, it is automatic. The things are forgetting by the old people, and what are the things are happening? We saw that in the old age, but dementia and the Alzheimer is a part of this thing. So how we have to approach and in which way? So like that is as a nursing we are going and aware the people Alzheimer is a one of the condition, it is happening in the old age, or the dementia, how we have to dealing with the people, that we have to aware them, we have to give the health education and all thing. But how in in what in other way also we have to really our education should be thoughtful and the effective we approach that in which way, that I want to know that, like if any repeatedly we do the session or do the awareness program.
Okay,
And
yes, Jayashree, that's a very important point that you have hit on. I'm glad that you like the session. Thanks for
thank you so
attending.
much.
Yes,
Welcome, ma'am.
I hope that it's been very informative for you. So,
Mhm.
see, the thing is that like nowadays, it for as I mentioned that this is not our health priority. Unfortunately, it is not on our policy schemes and everything, right? So
Yes,
our organization or organize there are a lot of organizations like this for dementia across country. There are not many, but there are few and they are working rigorously towards it. So our intention is that the more we give the awareness, it will help, right?
okay.
Or so if you see in this presentation only, there are so many aspects like how to prevent it, how to
Yes.
manage the old age, how to what is cognitive well-being. So these are
Mhm.
certain aspects that we are trying to promote in the public, general public, so that you know about it. Now, in the same way, like how, say, for NCD cases or for polio or other cases, like it has become a part of it. Like how
Mhm.
in hospitals you walk in and you see so much of knowledge about it. In the
Knowledge.
same way, we have to promote the healthy aging. So not necessary that every elderly will develop memory loss or
Yeah.
dementia. It is not
Mhm.
like that. it is like, I think the numbers are very different compared to like the elder population. So
Okay.
even in elder population, we have to keep on working on preventive measures and understand
Mhm.
the reversible and irreversible causes. So
Okay, ma'am.
basically, this is not our priority, like not
Mhm.
our priority as in this is not the government's priority, but we
Mhm.
can work towards it and we can
Yeah.
make it because we really need, if the numbers are, see, in 10 years, this 8.8 million has become probably going to double up. So
Yes.
then probably, people might get to it that, okay, we really need the policy or something like that. And there are a lot of organizations working on it. But at this time, what we can do as individuals is that promote the cognitive well-being,
Mhm.
healthy aging,
Mhm.
generally, right? How we are promoting, like, for other diseases, in the same manner, we can do it for it. It will
Mhm.
reach out to people, it will help out. So that's how at least we can educate people that cognitive well-being. See, earlier it was like physically eat well, sleep well, like physical health was very important and everybody was concentrating on it. Then came the mental health in the same way now as the cognitive health, because there's a lot of longevity. People are
Oh,
going to live for long years because of
yes.
our good maybe nutrition, whatever the reasons. So people, the science says that, the research says that people are living longer. That means
Yes.
we have more old age people. That means we have to concentrate on their well-being, and that's the
Yes.
way we can do. So yeah, I think what we need to do is like promote the cognitive well-being, the
Okay.
brain health. There
Yes.
are a lot of, so for example, in Karnataka, with
Mm.
the NIMHANS, they have initiated the Karnataka Brain Health Initiative. So the
Mhm.
government has taken up this initiative and they work a lot on brain health. So it can
Oh,
be for younger population and older population. The
older
same way,
people.
Kerala has some government initiatives. So like that,
Mhm.
maybe each state can pick up something as an initiative for brain health and healthy aging. Yeah,
Okay.
yeah. I hope.
Okay, ma'am. Thank you so much. Thanks, ma'am.
Thank you.
This is from Miss Usha. My husband has significant hearing loss to wear in his left ear, but doesn't like to wear his hearing aid despite the doctor telling us that it could increase brain loss. How do I convince him?
That is a very interesting question. Thank you, ma'am, for putting this across. And it's also a very challenging thing. So, when we use the hearing aid, there is generally a discomfort for the person. And that is something that's the reason you have to go back to your, from where you got the hearing aid, or to the audiologist who will help you to have a better use of it. In my observation, I have seen a lot of people having these feedbacks coming from the hearing aid, or it is not being used. One thing is that there is a slight stigma also about it. People are not happy to use that. So how we convey the use of it also matters. That is one point. Then the other thing is that the actual device that is used, sometimes it is like, see, it is also a complex device to use. Like every now and then, probably you have to keep changing the settings of it to avoid the feedback or the proper. Now, these things, we have to work hard on it, or maybe you have to go back to the audiologist to fix or get a new device or something. So what happens generally, the trend is that when people have these hearing issues, when they are not able to hear, then they will start becoming more aloof. Then they withdraw from the community or the social integration, or even in the family, they will start withdrawing that, okay, anyways, I'm not able to hear, why should I put the effort? So we, as the family and the caregiver, has to put a little bit of effort to see that, okay, they are part of the social integration, they are not having issues. And the main thing that, as a psychologist, what I feel or what I have observed is that how we convey the person to use the device. Because once they start seeing it or stigmatizing it, then they are definitely going to use it as, like, a negative thing, that, and they may avoid using it. So hearing loss is definitely one of the risk factors, but there are certain things. So see, these are all like management of the issues. This is not like, you go to a doctor and they're going to give you medicine to how to use it. This is that we have to put in that effort, or some ways that how this person will get comfortable using a device, or will get comfortable using so that and have a better quality of life. That means that they are more involved in the day-to-day activities and all. So yeah.
This is a very important thing, and it's just not to do with the hearing device. It could be diapers, it could be a lot of things that as you age, people need to use and which they are uncomfortable with. This may look like a very small thing, but it makes a lot of difference to people who are aging and who have dementia. Thank you so much for
Absolutely.
that. Now, this is from Yasmin Zohair. I have heard some type of dementia is hereditary. Please advise on what type of dementia is hereditary. Thanks, ma'am. The session was very helpful.
Thank you so much, Yasmin. Yeah, good to hear that. Now, genetic dementia is something, it can be any of the type of it. It is not like which type. See, strokes can also be genetic, which can lead to further stroke induced vascular dementia, or Alzheimer's is also genetic. Most of this, they have a genetic predisposition, but it is difficult to say which one. If you are so concerned about it, or if there is somebody in the family who is concerned about genetic predisposition, I think the best would be to go to go and get a genetic test done. One thing is that, see, there are preventive measures which will help. So it is basically, but then if there is a factor of genetic, predisposition, then in that case, what we recommend is to go for a genetic testing so that you understand what are the possibilities of somebody getting dementia. It is not like which type will get. All of these types, like Alzheimer's, frontotemporal, vascular, Parkinson, they can have a genetic this thing. So, not like one particular kind of dementia. So, if there is something, I think if you are so much concerned, and if you can go for a genetic testing, I think it's available across a lot of cities. You can try that.
In Hyderabad, where do we get this genetic testing done?
Apollo Hospital is doing it, and that is one that I know. There are some other places also, but I can look into it and let you know. One, I'm sure that Apollo Hospital has it because they were working on a dementia research also. So they had something. But generally, it is a little expensive thing. I don't know the costing about it, but yeah, there are some tests available across Hyderabad.
Yes. Would you like to ask your question, ma'am?
Is it? Can I ask? So I'm
Yes.
Sumati.
Yeah.
Thank you, ma'am. Lovely session. It was so informative. Actually, my sister-in-law and her husband, they are suffering because of this. And he keeps asking the same question. And both of them are pretty old. She's 76 and he's much older than her. So she also loses her patience and she doesn't know how to handle this repeated questioning. So how
Yeah.
can we help them in such cases?
Ma'am, so you said both of them they have
No,
dementia?
no. My sister-in-law is 76. She's okay, but her husband is suffering from
She's,
dementia.
she's the caregiver. Okay.
Caregiver.
So see, it is very natural for a caregiver to lose the food. As I've been telling in the presentation also, there is so much emotional burden, physical burden, financial burden. Of course, it's like, and not to forget a spouse themselves, they are in late 70s. So they will have their own health issues, they will have their own things, they will have family dynamics, everything. So it just adds to the burden of it. Now, when we talk about caregiver support, that is what we try to help. That, see, we can't reduce somebody's burden, but at least we can support them. We can try to channelize that, okay, what more they can do. In this scenario, what we recommend is that the more they understand about dementia and the management. So if you see in the presentation also, I said that it's more about managing these symptoms. If somebody is asking the question 10 times in 1 hour, of course you're going to get irritated. But then if you're trained to how to, divert their mind or how to do the other therapies. So when we're talking, say for example, I'll tell you, like somebody is asking that, when are you leaving? When are you leaving? It may not have a context of it. So one way is to divert their mind. So if you know certain things about the person, say they like music or they like some other type of things, they like pets or there is like, say somebody is a banker who used to be like, completely engrossed into some maths activities or something. And if the patient is still able to do such activities, we can try to introduce, because when they are busy in these therapies, or when they are busy doing something productive or something that they like to do, they are bound to not ask so many questions. Why are they? See, in one of the slide, I said that it's a unmet need. So why are they repeatedly asking? Because maybe they have something else on their mind, and that's what is the brain is only saying. So a lot of time it happens in dementia. Even if they want like a glass of water, they will like, when are you leaving? Because that's the only communication that they are able to do. So I don't know exactly in your case what is the dementia type and what is the problem. But a lot of time, whenever there are these challenging behavior, it is unmet need. It is something that they want to convey, which they are not able to put it in the words like you and me can. So when we try to divert them with other activities, or say going for a walk or something, anything like a cognitive stimulation activities that I was talking about, when they are engrossed into it, these questionings, repetition, aggression, anxiety will come down. But then when we talk about these therapies, right, it again takes the patience. So it is a lot that we ask from the caregiver, but it is doable. It is like we need, now that we have spent so much of our energy into it, why not a little more of patience for a better, result of it? So diverting a patient works, but not like, how you would divert a child. Like in a way, it is like that only. Like, okay, offering a child ice cream, but a elder person, we can't offer them always ice cream or a chocolate. So you need to understand that what are the things they are interested in, what is the kind of activity they really like doing, so you can, try to divert them at that.
One more question, ma'am. Thank you so much for this. This unmet need was really important. Maybe, they have some unmet needs and we have to attend to that.
Yes.
One more question that I wanted to ask is, I do get opportunities to conduct awareness classes. So can I use this content for that?
You can absolutely, yes, you can use the
Because
content.
it's so comprehensive, na? Like we don't have to take so much trouble to give information. Like, we can talk to seniors when we
Okay.
get opportunity to address some seniors or some students, college students. So maybe, we could just, this awareness will help them as caregivers.
Yeah,
So
maybe you can discuss with the Vishwa Talk teams like how they want it to be done. But we're happy to do, like, if you want us also to do a awareness session, we are happy to conduct it. Or you can use the content, but please have a word with, because this is already like a recorded session, so I don't know how it goes.
yeah,
Um,
no, just take some matter from that
the
and then,
idea,
not
yes,
exactly copy it, but still.
no, 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 no problem. And the idea is
Sure.
awareness. The thing is that we want more people to know about this. So we're happy for it. Yes. You're
Thank
most
you so much. God bless.
Okay.
thank you.
This question again is, when one dementia patient forgets to swallow food, even liquefied and slushy food, do you put him on rules too?
Okay. So this is more like somebody who is in very progress stage or late stage of life, right? Now it depends a lot. That's why, see, it is a very you need to have that constant discussion with the doctors. It's very difficult to say without seeing a patient that okay, what would be the best for them. It is probably for this part, I would say that it is the best thing that the doctor decides that what is going to, because there can be so many medical complications also with the patient, so it's very difficult for me to answer something like that. But then that's the reason we say that dementia is a journey, and then the well prepared you are, it will help you. So at this stage, maybe you have some doctors who are like, who knows the patient in and out with their other morbidities and with dementia severity and everything, and they will be able to advise you best. So there are people who would need that kind of intervention, maybe pep tubes and all that. So it is the doctor who will decide best.
So there's a lot of people who have acknowledged this session. They said it's helpful, it's informative, it's comprehensive. It's invaluable, excellent, wonderful session. Matthew Thomas said there's a lot of clarity. Fantastic session. Jayashree says, thank you so much, ma'am, for this current important topic presentation. Thank you to the organizers. So there's too much, a lot of Mitra Day says very interesting and informative. Yeah. Next, wanted to know about the causes of dementia. Then it may be easy to prevent it. I'm sure you did cover the topic. If the person who can put the slide for a second on what ma'am had already given, it'll be good. Occupational therapy helps in caring for dementia patients. Could you elaborate a little? Anything?
Okay. So occupation therapy, basically for a patient, when you're asking, I think when it comes to dementia, we will just call it cognitive stimulation therapy. And so it is one and the same thing. And I will just repeat, like, so first you need to understand what the person likes. See, in occupation therapy, it's a complete different kind of a therapy for non-dementia patients. But when it comes to dementia, it is more cognitive stimulation therapy, where we try to understand what is their liking, what is their disliking, what is their background. So you understand the person-centered approach of the person with dementia, then you understand what is their current brain abilities, all the domains of it. Based on that, then you do the therapy. Then you offer them whatever the activities that they are able to do and that they like to do. So that would be it is nothing but it's the same concept of occupation therapy, whereas it varies for dementia. When we talk about, so it will be more like a functional rehab for dementia rather than like teaching them very new skills. So in dementia, we will see that what are the skills that they would need. We're not going to teach them like other life skills, maybe just the basic BADLs, what we call basic activities of daily livings, like going to bathroom or using bathroom or brushing, eating, and all that. So that would be more of the therapy that would be done under cognitive stimulation, brain exercise, and functional rehab, what we call. I
Okay.
hope that helps.
Yes, Saraswati ma'am, please.
Yeah, thank you. It was a very good session, very informative, but as you have also mentioned that every patient is unique. So that way I'm dealing with my husband who's having this problem, and I think it has gone undiagnosed initially. And that's my question, that Alzheimer, dementia, Parkinson's, they have overlapping symptoms, very, very highly overlapping. So it might, can it be that he has been treated for Parkinson's and the medicines have sort of had a negative impact on him, but he was actually having Alzheimer, the initial part of it, initial stages of Alzheimer?
Okay, so yeah, let me try to answer you this. The type of disease. So generally what happens in India, I'll tell you in my practice, in the memory clinic where I work, right? Because when we say that there's no awareness, right? So even in the medical society, there's not much of understanding of dementia. So when I get patients, it will be written only dementia. So from my experience and from my test, then I'll be like, okay, it looks like Alzheimer's or it looks like. So there are very limited medicines or medical intervention for dementia, treatment for dementia, and that will be common for all. So it is not like Alzheimer's will have a complete different set of medicines or frontotemporal will have. What happens is Alzheimer's will be a complete different set of symptoms, but the medicines will more or less be same for frontotemporal, for Parkinson, for vascular. Now, for Parkinson, I believe you must have gone to a neurologist.
Yes.
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 So it is more or less the same bunch of medicines which are prescribed, and that's the reason why we say there is not much of medical medicines available for dementia. So it is unlikely that there has been some medical mismanagement or there is he was given any wrong medication, he had something else. And there is also a concept of mixed dementia because brain can be so complex. Maybe it starts with Parkinson and then gradually it shows the other set of symptoms. So then in that way, we will call it mixed dementia, where the person will have different subsets of symptoms from each type. So that again is like limited medication and not, I don't think so it is possible that, the doctor must have given something and the mismanagement will cause some other this thing. In dementia, Parkinson, Alzheimer's, anything, the medicines will have a limited role. And what more works is the therapies or the way we care for dementia. So, if I have to show you the slide, do we have time? Can I just show that slide?
Please show.
Yeah, okay, let me share. Okay, let me just a second. I'll quickly try to go back. Just a second, ma'am. Okay, so if I have to show you this, see, medical management is actually a very small part of it. Then, after the dementia diagnosis, the involvement of medicine is important, but it is very small. What other things we need is non-pharma interventions, when we say, is like more of therapies, care management, how to deal with the issues that they are facing, and the caregiver issues. So, this will show you a little idea about the medicines have a small role. Then comes the other care management for the person with dementia. The orange column that you see is completely for the caregiver. So this is exactly what is dementia management. So what I wanted to show over here is that the medicines have very small but crucial role, which the doctor decides. And when we try to do interventions, therapy, and care, we do not do much of the. This is all combined together. It is not like, okay, just medical this thing or just only the therapies. Some people with therapies will also need medical treatment. So when we say medical treatment, it can be like certain medicines for the brain to slow down the progression or certain psychiatric medicines for the behavior. So it is mainly the doctor who will decide it. But I just wanted to clarify that it is not like, it can have any significant role that the medicines would have been mismanaged.
See,
Does
what
that
I
answer? Yeah.
no, please continue.
Sorry, could you
Please continue.
repeat?
Yeah, I was saying that I have always seen my husband having a negative impact with any neurological intervention, medical intervention. So I actually went to a geriatric doctor who helped me to reduce, taper down those medicines. And even in the recent past, he was given Exelon. I think that it has a very good this thing about
Are you
record about
using the
having
patches?
patch, not the patch. They gave him medicine tablets.
Okay.
So then also he was absolutely, absolutely like a zombie. He was dead to the outer world. I knew it was not working. The doctor wouldn't listen to me.
Yeah.
So finally,
So,
this doctor, the geriatric doctor, was not doing any consultation at that point of time because of his health issues. So, but I intervened. I went to him. I found out from him that I can stop it. So once I started reducing it, he's slowly coming back. The medicine has been stopped in January, but even today, I'm seeing some positive impact of what he was before the onset of the medicine start. So I'm very surprised that why I don't know what the problem is with him. I don't know what the
so
solution also.
all right, I'll tell you a couple of things. One is that you need to see, if there is a heart problem, you'll go to a specialist, right? You'll go to a cardiologist. You won't go to like a nephrologist for a heart problem. So, in the same way, if there is a dementia, you need to reach out to the dementia specialist, not like people who don't know what is dementia. But see, it is not like the doctors don't know. Of course, they know. And one thing we need to understand as a general public is the neurological medicines or the psychiatric medicines or the geriatric medicines, right? They are very complex. They are very tricky in the same way that how they react on one particular person. No two people are same. No two dementias are same. No two brains are same. In the same way, the medicines, when given to certain people, because of their different types of disease and different way the body is, it will it will react in different way. So what we, and I have had a lot of people coming with this issue, trying to discuss with us. So see, the thing is that best is to go back to your own doctor and understand that okay, this medicine is not working. As a family, as a caregiver, you're the best person to take the decision that okay, something is wrong. So if the doctor has prescribed the medicines for a month, doesn't mean that we have to take it for a month. If we see a changes within a week, we have to go back to, and these medicines, right, neurology or psychiatry, it is not like, oh, I just want to stop because it looks like some side effect. We should never do that. You have to go back to the doctor and they will gradually decline. Or they may know that, okay, maybe this drug is absolutely okay to stop. So that is the medical management that the doctor has to deal with it. Right. That is one thing. And ma'am, I'll tell you one thing. So different practices, say in US and compared to India. In US, certain of the dementias, doctors will never prescribe any medicine. They'll be like, okay, there is a brain atrophy, and that's it. There is no medicine that is going to help you. Whereas our practices are slightly different, where we use very low doses. Uh, so there are a lot of things that are involved here. So there are a lot of people who believe that dementia actually doesn't need any medicine. Or after certain level, after certain stages of dementia, moderate to severe stages, the medicine may not be much of help. Then what helps? Then it's only the care management. Then it's only the therapies. And trust me, the therapies now probably when you see on the screen, it looks like very childish. They're like, oh, ye to fun hai, hobbies and all that. That is actually the cognitive reserve that is much needed in dementia. And that is one thing that helps. I did mention somewhere that there was a lady with Alzheimer's who lived for 16 years. I think after 4 or 5 years after her diagnosis, the family completely stopped the medicines and she lived only on cognitive stimulation therapy. And that definitely, you can imagine somebody living with 14 years, 16 years of dementia. So, to have a quality of life, it is a combined thing. Whenever medicine is needed, please take it. But the other thing, that's why I did mention in the presentation also that the therapies and the cognitive stimulation that we mentioned is as equivalent to a medicine that you will take. It is all together. So I absolutely understand that when we say this to the caregivers, it is like very taxing. And you see, as a family, you will be like, yeah, in his or her lifetime, they have not done anything like this. Now they are not. So you need to derive things. Kuch to kiya hoga, something they must have done in their life. And from that, then we have to start deriving the activities that they are still able to do. So I hope that helps. Or else, ma'am, you can connect to me
Yes, we'll have to
one-on-one.
move a little quickly.
Yes, sorry, I think we took a lot of time.
Yeah. So,
Yeah.
Yasmin,
I thank you for all the responses. Thanks.
Most welcome.
the question from Yasmin, why do dementia patients become abusive? My 90-year-old mom with undiagnosed dementia is very abusive to my sister-in-law with whom she lives.
Yeah, very interesting. So it is nothing but an unmet need, or there is definitely something that is happening cognitive in the brain that they are reacting to. So, for instance, like some people get very angry seeing new people. One reason could be that they're not able to recognize. One reason is that they're trying so hard to recognize that this is my daughter, my sister, but they're not getting the names. So they also have the insight that they're not getting it right, or the way the person communicates. There can be multiple reasons why somebody can get aggressive. For instance, like a patient, like, with one person, they're very good, but with the other person they are very aggressive because somewhere they have, like, put them in certain categories. So after dementia, it's like they have forgotten the actual roles of the the children or the siblings or the relations. Now they are just seeing that who is my care provider, who is letting me give me that freedom. I'll just elaborate it quickly over here. So, as a caregiver, we are very concerned about the patient, right? We will say that don't go there, eat this. Did you eat it on time? Did you take your medicine? Did you do? So, if I have to put it in Hindi, we generally say that आपने ऐसा किया, ये करो, वो करो, जाओ, आओ, खाओ, no. Every time we are giving a command or we are asking them questions that they are very uncomfortable with. आप मुझे भूल गए. You forgot about me. You don't know who I am. I'm your daughter. So these are negative things. And the way one person tries to communicate with the dementia patient may not have memory, short-term memory or something, but they will always identify the person like this person is good to me. The other person is always like asking me to do something challenging or asking me things that I don't have questions. So you imagine who you are going to be more comfortable with someone who's making you comfortable or someone who's making you, in a complex situation. That could be one reason. There are multiple reasons. Honestly, why somebody can get aggressive, or there is a reason that maybe they associate that person with something that triggers off some other memory. It's very difficult to say, and that happens very frequently at our center also. Suddenly, somebody will walk in who has just stepped in for the first time, and the patient will go off saying that I hate you. It's like, okay, that person has never seen them. So they are associating because the cognitive domains are so impacted. There is a high possibility that they are like mixing up communication or mixing up information. So I hope that helps. And considering the time, if you have any other questions, I'm happy to take it. Like maybe you can reach out to me on through our organization.
Yeah, sure. There's a few questions.
Sure.
Good afternoon, ma'am. This disease is happening in younger ages. What is the symptoms and how do we recover? What is the homemade remedies for this disease?
Okay. So the remedies we have already spoken about the preventive measures. Preventive measures nothing but having a cognitive well-being. Your brain is healthy, it will help. Your physical health has to be in a good state, mental health, sleep, right? Hypertension. Also, these are the preventive measures and the risk factors that we have already discussed. Now, why do people get in younger age? There are two things. One is genetic. There are some people who will get in very early stages, like early ages, like in early 40s or 50s, and that can be like a very specific kind of dementia that happens. So in frontotemporal, like there are some cases that we see that are genetic predisposition, or in certain cases it can be head trauma, head injuries. So that could lead to a very early this thing. Other things that can lead to early age dementia is stroke, post stroke, or cardiovascular diseases. So these are certain reasons, but the numbers are much less compared to somebody having dementia after 60s to somebody having in a younger age. But yes, we are seeing a lot of cases which are in their 40s and 50s also because of the things that I just mentioned. How to prevent is again like, we just have to be careful about things. We have to take our health, our mental health, our cognitive health. So far, I think you must have just heard about physical health and mental health, and I'm adding that aspect of cognitive health over here. So it is cognitive health, whatever your age is, you're in your 20s, childhood, 30s, 40s, whatever it is, make sure that cognitively also you are healthy. And we have already discussed in the presentation how to be cognitive healthy. And the fun part or the best part about it is that the hobbies, sometimes I feel that it is a god gifted thing to us. We did not pick up hobbies like because I wanted to pick up. We were given that skill. So God has given us certain skills which are fun, which we call our hobbies. Work on it throughout your life. Work on it, like if not every day, like spend some time for yourself. It will help you for your mental well-being and for your cognitive well-being. So I hope it helps.
This is from Usha. Is it true that Alzheimer's is more prevalent in the West because of overconsumption of highly processed foods, and that the same trend is increasing in India, which might be a reason for increasing cases in our country?
Absolutely, yes. So earlier, as I said, we used to call it like the Western world's disease, but now it has become that India is one of the, very big population of dementia. 8.8, I think it has become more than 9 million by now. So the thing is that it is a lifestyle. Earlier, say 20 years back or 30 years back, Western world has they had a lifestyle where there was like shelf food. They had like more of snacking and junk food. So they did not. So a lot of countries, say US and all, where the cardiovascular rates are really very high. So of course, like if hypertension, diabetes, obesity, these are the risk factors. So if that is more prevalent in the population, there's a high risk that, of course, after 20, 30 years, it will convert into dementia also. So earlier, our lifestyles, like 30 years back, our lifestyles was very different. We used to walk a lot. We did not have so much of junk foods or franchisees and the food habits or shelf food and so many other things. Nowadays, it has become very common that every other person has a hypertension, diabetes, or some other cardiovascular issues, and the inactivity. So our, the economy has changed where we don't walk also. We don't unless we go to a gym or unless we go for a very specific walking activity. So our lifestyles have changed. We have adapted the Western lifestyle, and with that, it has come with all these negative things. So yes, the more our lifestyle becomes unhealthy, it will bound to have more number of dementia.
Last question, ma'am, from Usha. Our mother was so nice to outsiders. People said your mother is so amazing, but at home she's always critical of us. However much we try to be on her good side. Why does this happen?
Is this related to dementia or non-dementia?
Usha, if you're online, you should talk.
Yeah. So, okay, I'm okay to answer both. So, non-dementia, it is like a lot of time there are personality issues or personalities where people behave in such a way. So, it could be different types of personalities where we call that, friendliness towards strangers. Whereas with whereas with family people, they will have a complete different personality. So, so the question is for dementia. Again, so in the normal people, there can be a personality issues. Whereas in dementia, it is also a part of personality, but in dementia, that is also like familiarity with strangers. Why? I'll tell you. Now, with the family, the person has an insight and the sense that the family knows that I'm forgetting, I have issues, I'm not able to do my familiar task or the dementia issues that she's facing, memory loss. With the strangers, they are able to play the role that they are healthy, that they are able to show others that there is nothing wrong with them. So when the other people try to talk to them, they'll be like, she sounds absolutely well. So in dementia, see, the different domains are impacted. Maybe in Alzheimer's or in the certain dementias, the language is very well. So when normal people try to talk to the dementia person, they'll be like, she spoke so well, but you spend 2 hours with that patient and be like, no, there's something wrong. So that is what happens with the strangers, that they are not able to pick up that, oh, Alzheimer patient is acting in such a way. Whereas for the patient, if you have to think about it, the patient will always be like trying to hide, trying to cover up. So even though they have the insight that I'm forgetting, I don't know who the say the neighbor who has walked in, they will very nicely cover up, like, yeah, yeah, we met the other day, right? You brought something, but if you actually see, there is no facts in it. So it's not factual that they are talking. They are just talking to cover up. They are just talking to fit in where they want to kind of show that they're absolutely normal. And that is something very common in dementia, where they have a lot of familiarity with strangers. They're comfortable that this person doesn't know that I'm forgetting, whereas my family knows I'm forgetting. So that could be one reason. I hope that helps.
Last question again. How to toilet train dementia patients?
Okay. So there are a lot of issues over here when we say toilet train. They're not kids, first thing. Kids, it's easy. You can train them in multiple ways. Whereas in a dementia patient, as I said, that they always will have an insight that I was a professor, I was a doctor, how dare you talk to me? So that insight is there. So it is difficult to say train somebody into it, but what we would call it from the dementia perspective is the functional rehab. This is what is functional rehab. That we give them the rehab to maintain their current abilities, their daily abilities. A lot of there are multiple aspects over there. How to train them? We can't. One is the communication and rapport between the family or the caregiver. If your rapport is bad, like how I gave you the example of, say, the two daughters, like somebody is good and somebody is like making the person feeling very challenging. Of course, she's not. Who is the person? Who is the patient going to listen to? The person who makes them more comfortable. That means the rapport is good. Whereas they're not going to listen to the person who keeps commanding and puts them in a very difficult situation. So that means, like, if there is a toilet issue and we want to train them or we want to remind them, I think rather than using the word train, I would say that, we keep on giving them cues. So it will be from the person who has a better communication with the patient, who has a better rapport with the patient. At the same time, they keep forgetting. Maybe the short term memory is really very bad. So they may not remember what you just said 5 minutes back. So in that case, you can put a lot of cues like stickers or things where you have like cues written that please flush after use. Do not do this. Switch on the light. It comes to a point where somebody has to intervene, like maybe another person, a caregiver, a attender, has to walk in the bathroom to help the patient. And that happens very commonly in dementia and Alzheimer's. A lot of in severe stages, this is bound to happen. So if the person doesn't have a good rapport with this attender or the person, or they keep forgetting that who has walked in. Imagine, like, you are busy with your business and somebody walks in. You're definitely going to be very angry. You will shout, you will hit, you will throw things. And that is what happens with the dementia person also. So a lot of time I would say that you have to put yourself in their shoes, start thinking from the cognitive skills that they are left with their personality, with their stage. Like they were like somebody, they were head of the family, they are somebody, elderly person. Start thinking like that, and then that is the reason why we do a lot of dementia training for caregivers and for the so that you understand how to deal with these things. See, right now, if I say you have to make a rapport, it doesn't make sense. You have to understand the concepts behind it. And then it makes, that's why I say that it needs a lot of patience, but it's doable. It's absolutely doable. It will definitely impact the quality of life. So the more the dementia patient is happy, it will impact in the daily life also, the quality of life. How do you keep them happy? With the therapies that we are talking, the cognitive stimulation. So everything goes back to the therapies and cognitive stimulation and how to manage the communication and all. So I hope that helps. Thank you. Ma'am, you're muted.
What happens when they age, they stop going out, they stop interacting, they become quieter? What can we do about it?
Yeah. So what happens is like, see, I think the best thing I can say that if you can send them to places like dementia centers, dementia daycares. Why? Because they are trained people who know that in a very severe stage how to deal with a dementia patient. Also, I say that it is not rocket science. It is absolutely doable at home also, but it needs a lot of your patience and your time. The thing is that there was a lot of discussion. In fact, there was a lot of debate in West that why do we even call them patients? They are not patients. It's a disorder. Okay, so that is a very interesting concept that we need to understand. They are having they are having cognitive issues, they are forgetting things, but they are not patients. Physically, they are fine. A lot of people are physically fine if they don't have other comorbidities. So why are we treating them like the patients? They need to have a normal life, like you and me, like how we have breakfast, how we go out, how I do gardening or any other thing, right? Now the thing is that their brain is impacted. They don't know how to do things that they used to do in their normal life. So we need to cut down the level of those activities and give it to them. Say somebody like gardening, they may not be able to take the right decision, but they can still water the plant. So they may not be able to do the 100% of the things that they were doing earlier, but still they can do that 10% or 20%. Why are we not letting them do it? Let them do it. Maybe somebody was like, so I had this person who was in a very severe stage, but he was a stock market person, and he did not like doing any other activities. The minute I used to ask him, what is the stock market today? He used to smile like a kid. He used to be so interested. So then gradually we gave them, he was a patient coming to our center. So we gave him a laptop. He doesn't understand anything about stock market, anything. But he understands these words, stock market, Bombay market, and stock going up, NEFT, and all those things. So he's happy in that. And he had that sense of fulfillment that he's still able to retain his self. They don't know that 100% they are not, fulfilling it, but they know that they are fulfilling it. So even though they are not, say, somebody is not able to go out to a party, at least you can take them out for 5 minutes or 10 minutes to the neighbor's house. Or you can invite some people at your house and say that it's a dementia person, just be around, just be normal. So one thing is that we need to stop thinking them as patients. It's a disorder. They are normal people and their brain is not working well. So we need to give them that environment. I always say to people that don't treat them like patients. They have a lot of energy. And if that energy is not used, then they will behave challengingly. Then they will show aggression. Then they will probably wander. They will walk up and down. They need productive. Human is a productive person, has productive being, which has to have something to do every day. So when you incorporate therapies or any activity, meaningful activity for the dementia person, they will feel that content. They will have that sense of fulfillment. So I hope that gives you some insight.
Wonderful, ma'am. Sadia, ma'am, it's a very sensitive topic. It's a reality in most families where parents are getting old. Very lovely of you to be so patiently answering everybody's questions, their pain points, their anxiety, anguish. Thank you so much. That was wonderful.
Most welcome, and thank you so much, ma'am. I really appreciate your platform, the way it's working, and the way you are trying to reach out to general public. So I really appreciate your team and the efforts that you're putting into it for the general public. Thank you so much for giving me this opportunity. Really, thank you. And I always love coming to Vishwa Talks and delivering these talks. I'm happy to come back and whatever I can help from my side with respect to the cause of dementia. Thank you so much.
Thanks to the
Thank you so much.
Carry on, Trisha.
Thank you so much, Satya ma'am. Thank you so much, Shravani ma'am, for joining us. For anybody who's missed any part of the talk, you can access the YouTube link from the chat box. I've also posted ARDSI Hyderabad website so that you can support them and donate to them. I'm also going to mention vishwa.org so that you can check out the activities going on at Vishwa and participate in the Zero Waste Hyderabad campaign, also in the material collection and donation campaign. With that, I'd like to announce the closure of this particular session, and Sadia ma'am, I'll request you to join the breakout room link that will pop up on your screen.
Perfect.
Shravani ma'am, kindly
Thank
join
you.
the breakout room link. Thank you everyone for joining us. I hope to see you next week again.